Today, we are going to review the essential steps for the priming and loading of the IV infusion sets for the Meridium 3860 MRI IV infusion system. We will focus on the Meridium 1057 syringe IV sets components and when to use the 1057 syringe IV set. Additionally, we will provide step-by-step instructions on how to prime the set, install the set, and finally uninstall the set to reduce potential errors with the pump. Prior to attempting to prime and load a Meridium IV set, ensure that all 3860 system components are sufficiently charged. All components are powered on and communicating on the same wireless channel. Be sure to use a new sealed IV set within its expiration date. And please review the initial setup video if additional preparation information is required. Step 1. The 1057 syringe IV set and its components. The 1057 syringe adapter set with its 4 ml priming volume is designed to accommodate up to a 60 ml syringe. The set components consist of a lure fitting incorporated with a stainless steel flow tube, an air vent port, an alignment disc, a section of silicone tubing, a black flow preventer clamp, and a slide clamp. The 1057 syringe adapter set has been manufactured with specific measurements designed to allow for a precise fit within the IV pump chamber. When handling the IV set, take care not to stretch the silicone tubing incorporated within the IV set as to ensure proper fit and flow rate during an infusion. When the infusion is in progress, the syringe's plunger will not nor needs to be depressed. Additionally, do not place a stopcock or clave between the syringe and the syringe tubing. Step 2. Priming the 1057 syringe IV set. For all IV sets, once the IV set is primed, the user will clamp off the black flow preventer clamp. Be sure the black slide clamp is pulled all the way out past the flush position. For the 1057 IV set, the user will pre-fill the syringe with medication to be infused. The user will then carefully attach the syringe to the lure fitting, making sure the stainless steel flow tube is sealed properly within the syringe and slowly turn until the syringe is snug. Next, the user will verify the black flow preventer clamp is in the open position and the air vent port is capped. The user will then slowly depress the syringe plunger until the entire length of the IV set has been primed. Next, the user will close the black flow preventer clamp and open the air vent port cap. Finally, the user will pull up on the syringe plunger and look for bubbles to appear inside the syringe. As a precautionary measure, it is recommended the white slide clamp on the 1057 syringe set be placed in the closed position until the user is ready to start the infusion. Step 3. Installing the 1057 syringe IV set. Although the Meridium IV sets may differ in their clinical applications, the method by which they are installed into the pump chamber is exactly the same. First, the user will open the easy latch door by simply pressing down on the purple button and lifting up on the silver handle. Next, the user will insert the alignment disc into the port at the top of the pump chamber. The user will gently snap the alignment disc into place. Be sure to take care when handling the IV sets that the user does not stretch the IV set's silicone tubing which loads into the pump's chamber. Stretching this section of tubing may prevent it from aligning properly along the peristaltic rollers and may cause an inaccurate flow rate. The user will then firmly grasp the flow preventer by placing their thumb on top of the clear arrow on the flow preventer clamp. Ensure the clamp is pulled completely out to the closed position. The user will insert the black flow preventer clamp into the lower port by pushing down on the spring-loaded platform and then in towards the pump in a down and in motion. Once the flow preventer is installed, do not push in the black flow preventer clamp, as this may open the clamp and allow a free flow of fluids. Next, the user will position the tubing into the bubble detector by gently inserting the tubing into place. As a best practice, it is recommended the user inspect the installation to assure the tubing is correctly loaded and properly aligned before they close the door and secure the latch. Be sure the latch is flush with the door to ensure the door is completely closed. Finally, the user will open any closed roller clamps, slide clamps, and air vent ports to verify there is no fluid flow. The user is now ready to program an infusion. Step 4. Uninstalling the 1057 syringe IV set. Once the infusion or the patient's MRI exam is complete, the user will disconnect the IV infusion set from the pump. First, the user will close the slide clamps or roller clamps to prevent free flow. The user will then open the pump's door. It is important to remember as the door opens, it will automatically clamp off the flow preventer, which accounts for the initial resistance the user feels upon opening. The user will then grip the black free flow preventer clamp like a handle and pull out and down to remove it from the lower port. The user will unseat the alignment disc, remove the tubing, and close the door. The Meridium 3860 pump is now ready for its next patient. For more information, visit www.IRadimed.com. For technical support, please call 407-677-8022.